So today the last session is on chronic diseases, and here we will be concluding the reading of chronic diseases. In fact, I have named this session as the reading of chronic diseases because we are jointly reading these particular descriptions of secondary psora, and the last part is psora body, secondary psora body, last part, part 3, under which we will be seeing extremities, generalities and skin. Now, under extremities we find these symptoms written continuously. As you must have seen the chronic disease, these symptoms are written continuously. We have given headings to them to understand more easily. Upper limbs, lower limbs and limbs in general. Now, symptoms of upper limbs. The joints of the fingers are swollen with pressive pains, painful when touching and bending them. Then in the limbs, drawing, that is tearing, tensive pains, partly in the muscles and partly in the joints, which go under the name rheumatism. In the periosteum, covering of the bone, here and there, especially in the periosteum of long bones, pressive and pressive drawing pains. These spots then also pain on being touched, as if they were bruised or sore. Then stitching pains in fingers or toes, that is, in worse chronic cases, this is aggravated into a cutting pain. The stitching pain is more severe and becomes cutting pain. Crawling or also pricking formication, that is numbness, as if the limbs going to sleep, in the arms, in the legs and other parts, even in the fingertips. So these 6 symptoms of upper limbs. Then lower limbs are only 4 symptoms. Stitches in the heels and soles of the feet while standing, burning in the soles of feet, especially at night under a feather bed. Feather bed is a bed in which is a soft bed. Earlier it was used, feathers were used. If you type in Google search the meaning of feather bed, you find interesting past information about it. So that is soft bed. In the joint of the foot there is pain on treading, that is walking, as if it would break. A crawling or whirling or an internal itching, restlessness, especially in the lower limbs in the evening in bed or early on awaking. They must be brought into another position every moment, that is restlessness, position is being changed. Then finally 17 symptoms are under limbs in general, which you cannot call either lower limbs or upper limbs. In the joints, a sort of tearing like scraping on the bone with red hot swelling which is painfully sensitive to touch, that is arthritis, and to the air, with unbearably sensitive peevish disposition. This disposition, irritable, angry disposition. In gout when there is pain in the lower limbs, that is called podagra, and chiragra is the pain in hand. These are the symptoms. These terms are even used today. Gout in the knees, etc. So here the symptoms. Then the asterisk says that the pains are either worse in daytime or at night after every attack, and when the inflammation is past, the joints of the hands are painful, as also those of the knee, the foot, those of the big toe when moved. Big toe, there is a propensity for gout to affect the big toe, when he stands up, etc. They feel intolerably benumbed, numbness, and the limb becomes weak, that is lameness. Then thickening of joints, they remain hard, swollen, and there is pain on bending them. The joints, as it were, stiff, with painful difficult motion, with ligaments seem to be too short, that is tendoachilles, on standing erect, stiffness of the tarsus, that is the bones of the foot, of the knees, either transient, that is temporary, after sitting, when rising, and or permanent, that is contraction. When there is contraction, these pains become continuous. Joints are painful on motion. Shoulder joint on raising the arm, the tarsus pain on treading, that is walking as if about to break. then joints crack on moving, or they make a snapping noise. There are crackling noises, snapping noises. The joints are easily sprained or strained. Now, tendency to suffer from sprain and strain is here: tarsus, wrist joint, joint of the thumb. Then increasing disposition to strains and to overlift oneself even at a very slight exertion of the muscles. Even in slight mechanical work, in reaching out or stretching for something high up, in lifting things, they are not heavy, in quick turns of the body, pushing, etc. That is, by slight pushing also there is trouble. Such a tension or strengthening of the muscles often then occasions long confinement to bed. After that, the patient is confined to bed for long time, swoons, that is vertigo, all sorts of hysterical troubles. And under hysterical troubles, there is a long list which you can read. Often also at once severe headache in the crown of the head, which is then painful externally when touched, or suddenly a pain in small of the back, I'll read it, or pain in the uterus. Uterus, because this hysteria word had a history, that hysteria means suffering connected with uterus. So that here pain goes to abdomen, you may say, not frequent, or pelvis, not frequently stitches in the side of the breast or between the shoulder blades, which check the respiration, or painful stiffness of neck or spine, frequent audible eructations. That is multiple hysteric symptoms which you may also, today's knowledge may associate it with somatic anxiety. Then fever, hemoptysis, etc. While persons who are not psoric, one who does not have psora, he may lift burdens as their muscles are able to without slightest after effects. Everybody does not have problem by lifting weight. So those who are psoric, they have this. Under 2 here, the common people, especially in the country, villages, seek alleviation through a sort of mesmeric stroking, that is mesmeric stroke, etc. But without lasting effects, tendency to overlifting nevertheless remains. It is usually women who call stroking women, that is the mesmerism, who make with the tips of her thumbs pass over the shoulder blades towards the shoulder along the spine, sometimes also from the pit of stomach along below the ribs only. They usually exert too strong a pressure while stroking. Now, so then you see the symptoms of joints, that is false step here, that if the step stumbles, that is called false step. So there is a tendency to sprain. And then you see here softening of the bones, curvature of spine, then fragility of bone symptom you find here, painful sensitiveness of the skin. This symptom also you can read. Then we go to intolerable pain in the skin. Symptom of lower limb associated with skin has been mentioned here. And then you find that of incredible varieties, many varieties of skin and bone complaints you find here. We can read it at leisure. The numbness of the skin of all muscles, of certain parts and limbs. Here sense of touch is lacking. That means there is anesthesia, or there is sense of touch is missing. Then you find dying off of certain fingers or hands or feet. Dying off means again going to sleep. The limb becomes white, bloodless. Now not only are going to sleep, but then these are the symptoms which are having some sort of gangrenous tendencies. Then painful sensation of cold in various parts, burning pains in various parts, and coldness sensation. So these are the symptoms of limbs in general. Then after this we go to generalities. In generalities we find the symptoms. It's a big chapter because symptoms of sleep, symptoms of temperature and weather, symptoms of fever, attack, periodicity, tissues, touch, passive motion, injuries. Now these headings are not provided by Hahnemann as we have seen. These are mentioned in Hering's guiding symptoms. So under these headings we have tried to club this for the comfort of our study. Now almost constant yawning, then sleepiness during the day. This is insomnia insomnia does not mean only not getting sleep. Sleep disorder describes even hypersomnia, that is getting more sleep because appropriate sleep is not there. We find this described as a symptom of sleep disorder nowadays. Difficulty in falling asleep. He passes nights in mere slumber, that is just lying down but not getting sleep. Sleeplessness from anxious heat. Then after 3 o'clock in the morning, no sleep. Here is the symptom of depression. 3 o'clock, sleep getting disturbed, sleep vanishing is a characteristic feature of depression. So here we have to remember that, and sulfur for that matter, or psora, it's a special telltale symptom of psora, depression. As soon as he closes the eyes, all manner of fantastic appearance and distorted faces appears, that is the imaginary things, fear, etc. In going to sleep, disquieted by strange anxious fancies. So that is, the switch is not shut off, and that occurs in anxiety. In anxiety, what happens? The patient is not able to sleep, difficulty in getting asleep. But after the sleep is there, then he or she will be sleeping till morning, late morning. Whereas in depression, the sleep comes, but at 3 a.m. he or she gets up. Then very vivid dreams, as if awake, loud talking, screaming during sleep, somnambulism. So these symptoms are parasomnia symptoms, symptoms associated with sleep, that is sleep disorders, is parasomnia, hypersomnia and insomnia. Various sorts of severe pains at night, early awaking, dizzy, indolent, unrefreshed sleep after very restless night, often has more strength in the morning than after a quiet sound sleep again. So nightmare usually suddenly awakens in the night. So these nightmares, such attacks in some cases also occur several times in one night, especially when he has not been out in the open air during the day. So that is because of some lifestyle problems, this type of thing can occur, but more so in Calibrome you find this symptom, that there is night terrors in children. Then after sleep we see temperature and weather. Increasing susceptibility to colds, that is the characteristic. Then ailments following from it, from susceptibility to cold. Then so-called weather prophets, that is they can tell which weather is coming, whether it is winter or some rains are coming. So this patient will say, now I can tell you that it will rain. How do you know? Because particularly there is a numbness which I find in my body just before the rain coming. So they are prophets of weather, because their pains get renewed. Watery swelling, that is puffiness, either of the feet alone or in one foot or in hands. Then warm air in the room or at church is exceedingly repugnant. On one side there is a symptom that cannot tolerate heat, cannot tolerate cold. On the other hand, there is a symptom that cannot tolerate warm air. Then fever symptoms, we find intermittent fever, we know has relations with psora. Epidemic intermittent fevers, probably Hahnemann says, are never without psora. Then every evening chills with blue nails, every evening single chills. Then every evening heat, intermittent fever, several weeks of duration. Then chilliness constant, then frequent flushes of heat. So these symptoms of fever in secondary psora. Then attacks and periodicity, attacks of sudden heaviness in arms and legs, attacks of paralytic weakness, sudden bending of the knees, attacks of. Then children fall easily without any visible cause, then that is weakness in them. While walking in the open air, sudden attacks of faintness. At times the feeling of faintness seems to rise up even to scorbiculus cordis, that is the epigastric region, where it turns into ravenous hunger. With psoric symptoms, this ravenous hunger is associated. Then tissues we see, tissues tumefaction, that is swelling and suppuration of humerus, femur bones, then thickening and stiffening of joints, then glandular swellings around the neck. At times these swellings pass over, sometimes they become more increased when when a chronic suppuration sort of occurs, in which however instead of pus only colorless mucus is secreted. That is cellulitis. Then perspiration comes too easily from slight motion. That is what symptoms you find in antisoric remedies like calcarea, carb, netramure, etc. Then under perspiration of the hands and feet, that is later, that is feet smell is very bad smelling and so abundant that even after a short walk the soles of feet, the heels and toes are soaked and become sore. That is, their socks are always wet. And here in axilla, not infrequently, the red color of a rank smell, bad smell like that of goats or that of garlic. So bad smell, several varieties have been described. Instead of that, we can simply call it that it's very bad smelling. Daily morning sweats, often causing a patient to drip so much sweat that there is dripping for many years without a sour or pungent sour smell. No sour smell, often with sour or pungent sour smell. Then here belongs the perspiration of psoric children on their head after going to sleep in the evening. This is a psoric symptom which is found in calcarea carb also. One-sided sweat only on one side of the body, or only on the upper part of the body, or only in the lower part. So that is localized sweat, not the generalized sweat also is seen. Then generalized sweat also is seen. Then touch, passive motion and injuries. While sitting, the patient feels intolerably weary but stronger while walking. The predisposition to spraining and straining the joints, which we have already noted earlier, or by misstep or wrong step, increases at times even up to dislocation in the tarsus or shoulder joint, etc. Then the snapping and cracking of the joints at any motion of the limb increases with a disagreeable sensation. The going to sleep of limbs increases on slightest cause. Then we see the painful cramps in some of the muscles. Intermittent claudication, we have noted in the last lecture, increases and come on without any appreciable cause. Slow spasmodic straining of the flexor muscles of the limbs. Then sudden jerk in some muscles, tonic shortening of flexor muscles, involuntary turning and twisting of the head, or that is Saint Vitus's dance is chorea. So this choreiform convulsions, sudden fainting spells and sinking of strength, attacks of tremor in the limbs, attacks of loss of consciousness, epilepsies of various kinds. So that is all epilepsies have been listed here as psoric symptoms. Then last here is skin. Now skin is normally associated with psora, but Hahnemann has cared to describe many types of skin conditions here of his days. Let us see that. Varices, varicose veins in the lower limbs, and varices on private parts, also in the arms, often with tearing pains in them, or that is during storms, or with itching of the varices. The swelling of the arteries, aneurysms, seem to have no other origin than psora. Then erysipelas, partly on the face with fever, partly on the limbs, breast, while nursing, especially in a sore place. And then vitlo, paronychia, a sore finger with festering skin, chilblains, even when it is not winter, on the toes of the fingers and the fingers, itching, burning and lancinating pains. Then corns, boils, furuncles, then ulcers on various parts, thighs, ankles, etc. All ulcerations, especially at night, accompanied with erysipelas after vexation or fright, that is from stress, or attended with cramps in the calves, that is intermittent claudication. Now eruptions, either arising from time to time and passing away again, they come and go. Some voluptuous, that is very severe, itching, pustules. Why it is called voluptuous? Because itching is not associated, taken very nicely by people in the society. Even if there is an itching, it is supposed that you will not scratch that particular part. And if it is a private part, and if you scratch that, then it sends wrong signal, and that is called voluptuous. Whereas there is no feeling associated like that, but it is so much intolerable that patient cannot hold himself or herself. Now here various varieties have been described. Or nettle rash. Nettle rash is urticaria or allergy for that matter, we call it. Or pimples without pain in the face. Then next is herpes. This list is given. Then this is called salt rheum. Salt rheum, I have written the meaning, dictionary meaning is eczema. So that is salt rheum which was described. See, all sort, this has been mentioned in organon also, this particular feature of skin disease. All skin disease, crusts, or small round spots or red spots of skin. Now these terminologies have changed. Today we call it differently, and there is a description that skin is known to be polymorphic. Polymorphic means it has got many shapes, many forms, and not only polymorphic constant but polymorphic changing. It keeps on changing from one form to another form. You have a skin disease, you take some treatment, after some treatment the form of the disease changes. That is, instead of weeping eczema, it becomes dry eczema. All different names are used. So here you can read this very carefully and try to fit it into the current description of the diseases, skin diseases. Then freckles. Freckles are brownish melanin spots on the face. Then liver spots, they are also large brownish spots covering the limbs, arms and neck. Then there is yellowness of skin, yellow spots. Then yellowness of the skin, yellow spots are like nature around the eyes, mouth, neck. So this discoloration, now yellowish discoloration, today if you think, then you may relate it with jaundice, but here it is not jaundice for that matter, it is a complaint of skin. After riding in a carriage, yellowness of the skin comes on quickly or not constant but only occasional. If somebody argues that it could be jaundice 200 years back, 178 years back description is there, then I will keep my arms reserved and my opinion reserved for that matter, because this is to be interpreted in our today's knowledge. Then warts on the face, the lower arm, the hands, etc. Many times these warts of the face have been understood as psoric warts. Even those who believed in psychotic and syphilitic different descriptions of warts, and they also said that Dulcamara has the warts on the face and palms of hands. Now these are psoric warts. Especially in youth, many remain only a short time and pass away to give place to another symptom of psora. That is, psoric symptoms keep on changing, coming one after another. Encysted tumors of the skin, the cellular tissue beneath it, in the bursy mucosae of tendons, that is exostosis of various forms and sizes, cold without sensibility. Now cold without sensibility, here you can think of a cold which becomes chronic, number one, and secondly it becomes allergic without much sensitivity, that is without much complaints. The fungus hematodes, which has lately become such a dreadful plague. Now this fungus hematodes has been subsequently pathologically described as a skin cancer also. So according to conclusions, I am compelled to draw from several cases no other source than psora. Then finally, dryness of the skin, that is scarf. either on the whole body with inability to perspire through motion and heat, or only in some parts, especially on the hands, the outer side of the arms and legs, and even in the face. The skin is dry, rough, parched, burnt, like feels chapped, that is dry, and often has scales like bran. So that completes the description of secondary psora, and we have completed reading of the secondary psora, of latent psora from chronic disease which have been described. In chronic diseases, a special picture of syphilis and psychosis has not been described in details, it has been described in short. So for the present, this psora, secondary psora picture completes here, and if there are any questions, you can ask them, or you can even place them in